So now we will move ahead with the single drugs, gentamicin. Gentamicin, as you know, it is derived from Micromonospora purpurea. We have done in the classification Micromonospora per purea. Now it is the cheapest aminoglycoside, okay, and it is most commonly used in acute infections, and it is also used topically in ear or eye drops and for skin creams. So antimicrobial spectrum, it is highly active against gram negative aerobic bacilli, including pseudomonas uh, pseudomonas aeruginosa, and it is also active against few gram positive bacilli too, and it is not active against mycobacterium tuberculosis and other mycobacteria. Okay, so this was its antimicrobial spectrum, and its uses are in respiratory infections and in infections due to proteus, klebsiella and pseudomonas like UTI or osteomyelitis or otitis media, septicemia, and it is also used in, I'm sorry for the background noise, and it is also used for subacute bacterial endocarditis. Okay, it is also used for subacute bacterial endocarditis, and it is also used in meningitis. Like it is all used in infections, meningitis, peritonitis, and also in surgical prophylaxis. Surgical prophylaxis. Okay, so this was all about the gentamicin. So cheapest used for acute infections topically, antimicrobial spectrum. So they are the uses, and now streptomycin. So as you know, it is the least nephrotoxic drug, and it is has a narrow antimicrobial spectrum. That is, it primarily covers only the aerobic gram negative bacilli. Okay, and it does not have any effect against pseudomonas. I write like this so I can quickly go through it during the exams. So it has the highest risk. It has the highest risk of fetal ototoxicity. Therefore, it is contraindicated in pregnancy, and its uses are tuberculosis and zoonosis like brucellosis, which is Malta fever, and tularemia, if I'm not wrong, rabbit fever, and plague. Yep. Third drug is neomycin, which is the most nephrotoxic, as you remember from the adverse effects. It is the most nephrotoxic, and it has a minimal absorption from GIT. As it is most nephrotoxic, it is never used systemically. Okay, so it is used topically if we have external ear infection or infected wound, or burns and ulcers or conjunctivitis. And it is neomycin. In the classification we have wrote, it is used for bowel. uh, it is used for sterilization of bowel before surgery. So it is also used for preparation for of bowel before surgery. And it is also used for hepatic encephalopathy or coma, as it reduces the ammonia produced production in colon. Sorry for my this type of handwriting. So neomycin, it is the highest nephrotoxic drug and therefore it is not given systemically. It has minimal absorption from GIT. It is topically used in external ear infections, infected wounds, burn, ulcer, conjunctivitis, and it is also used for preparation of bowel before surgery, and it also in hepatic encephalopathy, coma, and decreases the ammonia production. So, fourth drug will be amikacin. So amikacin has a wide spectrum of activity because it is active against many organism resistant to any other aminoglycoside. It is used in hospital acquired gram negative bacillary infection which are resistant to gentamicin, and it is also used as a second line drug in multi drug resistant TB. Okay, so we will move ahead with albicacin. I'm sorry if my pronunciation is wrong. It is used in sepsis and pneumonia. It is used in sepsis and pneumonia due to MRSA, which is methicillin resistant Staphylococcus aureus infection. Okay, and it is also used in synergistic with beta lactam antibiotic, which is used in the combination in hospital acquired infection, multi-drug resistant pseudomonas and acinetobacterial infections. Okay, now the other two drugs are paromomycin and kanamycin. It is occasionally used as second line TB drug in multi-drug resistant TB in intensive phase. And paromomycin, it is given orally for intestinal protozoal infections like amoebiasis. Okay, and it can given be intramuscularly for visceral leishmaniasis, kala azar, and topically for dermal leishmaniasis. Okay, so